So why don't we get started? I'm Alfred Wong. I'm the Chief Operations Officer at Cortico Health. I'm very pleased to introduce our speaker today, Dr. Andy Minhas, who will, I'll pass it to you.
Thanks, Alfred. And we have Matt here as well, who's working with us and will be answering a live Q&A. But we'll have some time for questions and answers at the end as well, hopefully. But without further ado, let's get started. So I'll just share my screen. So welcome, everyone. So this is the 2024 Oscar Tips and Tricks webinar. Where we'll be covering over some efficiency tips and tricks to help with your workflow day to day in your clinic and with your practice as well. And a lot of what we'll be covering is basics. So we won't be going into a lot of things like grease monkey scripts. It's meant to be very user friendly and focused on quick things and quick fix that you can do to get efficiency gains. So I'm today's speaker. So I'm a family physician based in BC. I do longitudinal family practice. I also do episodic virtual care and First Nations virtual care as well. And more recently, I've joined on as a physician advisor for Cortico. As a disclosure, I work for Cortico Health Technologies. But to mitigate that, the majority of the tips and tricks discussed today, over 80%, will actually not be dependent on the use of Cortico whatsoever. Any Cortico-related tips will be highlighted, and I'll be covering third-party products as well, so nothing to do with Cortico or Oscar. So this is the agenda for today. We're going to be going over quite a bit. And so first and foremost, things like resizing Windows, managing things like Ticklers, using things called dot phrases, quick actions, renewing long-term medications, prescription shortcuts, using a request to book feature, which we're currently developing, eForm organization, automating billing processes to save clicks, updating directories, and also saving on costs such as faxing. And finally, we'll also talk a bit about eFaxing eForms and how that can avoid duplicative work in your workflow. So with that, let's get started. So based off of our guiding principles, there's two things that I really want to focus on today. One is a principle called the aggregation of marginal gains, and the other one is called organizing the chaos. And these two core principles is what really drives the efficiency gains when we're using Oscar. So what's the aggregation of marginal gains? Those of you who may know or may not know, this is Dave Brailsford. So Dave Brailsford became the head of cycling in Great Britain in 2003. Prior to that, Great Britain had endured over 100 years of mediocrity. They hadn't won a single Tour de France. They weren't coming in any medal positions. They were doing so bad, in fact, that certain bicycle manufacturers didn't even want them riding, using their bikes to make them look bad. So what did he do? So he comes in 2003 and he implements a principle called the aggregation of marginal gains. And what that basically entails is making 1% improvements in various areas to get to a bigger gain. So he started doing really random stuff. He would adjust the pillows that the players, the cyclists were using to adjust for the best recovery. He would use thermal shorts to help with performance. He hired physicians to help teach the cyclists how to wash their hands so they wouldn't get sick. He used rubbing alcohol in the tires to get better grip. He would even paint the room of the bicycle storage facilities white so he could pick up on specks of dust, which would hinder performance. So all of these little 1% things added up to something much, much bigger. So between 2007 to 2017, what did that result in? Those 1% incremental improvements resulted in 60% of the gold medals in Beijing Summer Olympics. In a 10-year period from 2007, there was over 178 World Championships, 60 Olympic medals, and over 5 Tour de France wins. He got knighted for his achievements. So what does that result in? 1% greater every day for a year results in a 37 times stronger result. However, if you're doing 1% less every day, it's 1,500 times weaker result. How does that carry forward into Oscar? So I ask you, what 1% changes could you make in your Oscar to get the best efficiency gains? When I looked through my Oscar and I looked at an unoptimized visit, when I was accounting for things like a lab requisition generation, prescribing, and also billing. An unoptimized visit to me was 23 to 25 clicks. When I optimized it, it was 15 clicks. So per patient, I was spending 35% less clicks. So ultimately, if you're seeing 30 to 40 patients, this certainly adds up in your time. Secondly, organizing the chaos. So Marie Kondo, you may have seen her show on Netflix, all about organization, tidying clutter, and in the end, sparking joy. Really caused a big movement here in North America when it came to cleanliness, but that was more so for physical spaces. Could we make the same inferences in a digital space? So I ask you, does your Oscar spark joy? Clutter can exist in digital domains as well. Digital clutter is increasingly a recognized phenomenon, and it is associated with things like anxiety, overwhelming, stress, and also poor performance in work. And I would argue that just like your home, your EMR requires ongoing cleaning. And there's something called the two-click principle, which I really like as well. So the two-click principle is the information you seek on your computer, is it 2 clicks away, or are you spending lots of time searching for it? And if you are spending a lot of time searching for it, could it be cleaned up a bit? So organizing the chaos. Marie Kondo actually has what she calls the KonMari method, which basically splits into 6 steps. So committing, and I would argue you're committing to cleaning your EMR by showing up here today. So maybe that's the first step. And then imagining kind of what the cleaning really needs to be. And hopefully I can help envision some of that as well. Discarding. So how many of you have old forms, retired consultants, or more clutter in your EMR, which is slowing down your work? Categories. So we're going to speak a bit about how we categorize things and how to order things as well. So we're following and maintaining an orderly approach to our EMR. And in the end, we want to spark joy. And ultimately, that's by saving time. So first and foremost, let's talk resizing windows. I'm going to be switching in between Oscar, so forgive me here if it's a little slow. So resizing windows. So how many of you, when you click your eChart, I have some test patients opened here, by the way, get a window which you're constantly resizing? Now, obviously that adds up to extra work and it's kind of annoying as well, especially if you're using the same computer every day. So one quick way around this is by going into preferences. So I'll probably go slower actually. So preferences is up here. If you go into preferences and encounter, there's a setting here called set default encounter window size. And what this allows you to do is change the encounter window size. So if you have a large desktop, it can be according to your desktop 24-inch screen, or if you have like a 13 or 15-inch laptop, it can be according to that. So I'll show you what happens here when I make it according to the window size that I use. So I'm just going to submit that and close it. And what you can see here is I'm no longer resizing the window. So every time it's going to open up to the correct size according to how I like it. And it's just saves that extra click as well. And it can be annoying as well because you're not getting a full screen of information. So some pro tips. You can also set Firefox to open windows in new tabs. So that's a setting in Firefox as well. So instead of opening it in new windows, you can also just open it in new tabs just to save those extra kind of the windows that pile up throughout the day. Number 2, ticklers. So how many of you, when you go into your ticklers, notice that it's everyone? So this is, I have the doctor's names blanked out, but your ticklers might look like this, where it shows everyone's different ticklers. And that's obviously really annoying because you only really want to see what's relevant to you, right? You don't really need to know about another doctor's recalls or another doctor's pap tests or anything like that. So ideally, you want to just view your own. So again, if you go to preferences, and if you scroll down to the bottom, there's a setting here called tickler settings. And forgive me here, this is Juno, but I believe you might have Oscar Pro or OpenOSP, but the settings are quite similar in all of them. But you can change the setting here to view only mine. And what does that do? So if you click save, I won't open my ticklers. I have them because they have patient information in them. But when you do view ticklers, next time you open it, it'll just show yours. So you go from having a whole list of them to just basically the 4 that are applicable to you, or however many that are applicable to you. So some pro tips. Preferences has various useful settings. So some of them we'll cover. So one is default billing form. So this actually allows you to set your own billing form. So we in our clinic, we have some doctors who are on new to practice contracts, others that are on fee for service, others that are on the LFP billing model. And so what you can do in preferences is set your billing form to be defaulted to your own. You can set a custom one if you wanted to make it, or you can create separate ones. So we have LFP, fee for service, and new to practice billing forms. And that way it just makes it more efficient when you're doing your billing. Edit your signature is another useful setting. For myself, my nickname is Andy, but my full name is Mandeep. And oftentimes my prescriptions get rejected if they have Andy on them because such doctor doesn't exist in the record. So when you edit your signature, you can really customize your name that it shows up on prescriptions so they're not getting rejected. Set to show patient's date of birth on prescriptions is also pretty useful, especially if you're seeing a private patient, because a private patient, it'll only show their name and address and not necessarily their PHN. And so we have had cases where prescriptions do get rejected if they don't show a secondary identifier such as a date of birth. So it's good to just have that on just to save any rejections. Manage comment box when acknowledging labs. This is pretty huge. So for some doctors, they find this quite annoying because every time you're acknowledging a lab, you have to enter a comment. When you have this turned off, so let me just show you. Manage comment box. So you can actually disable the comment box as well. So you can just click acknowledge and manually add any comments if you want, because you may not want to add a comment for every normal lab. And that can sometimes add tedious clicks to your day.
Hey, Andy, just backtrack a little bit. We have a question from Fiona Barker. I believe it was that the question was asked during the first tip on setting the window size. The question is, can this be saved per account?
Yes, yeah, it can be saved per account.
Great. Thank you. Thanks, Andy. Just for some quick housekeeping, I probably should have covered this earlier. If you have any questions, type it into Q&A. We'll try to answer it as soon as we can, if it's during the context of Andy's presentation. If not, we'll address it at the end. This webinar is going to be recorded, so we'll circulate the recording as well as all the timestamps. So if there's anything that you feel that you missed, feel free to use the recording to follow up. Andy, pass it back to you.
Thank you. So this next tip can be useful as well, especially when it comes to reducing digital clutter. So Oscar actually lets you set the display document that opens up. So when you're clicking a document, it can either open as a JPEG or as a PDF. I have mine set to a PDF, and you can also then set that setting in Firefox as well as to where you want that PDF to open. So I use a Mac, so it can be sometimes annoying if I'm opening a PDF and every time that PDF opens a preview window or an Adobe window. And sometimes I just want that document to open in Firefox because I don't necessarily want it to be downloaded. So you can set to display it as a PDF, and you can then change your Firefox settings to change it to only open in Firefox. So that way you're not just downloading every single document that you open up. So that's been pretty helpful for managing that clutter as well. Cool. Let me go to step 3. By the way, this is being recorded, like Alfred said, so feel free to refer back to it at any time. Dot phrases. So dot phrases is pretty cool. So I'll show you the old workflow that I used to do. I have a test patient open up here. So now this is the old way of managing templates, and dot phrases really come from Epic or an EMR in the United States. So let's say here I have a patient who I'm seeing in person. And so I'm typing a 5-day history of dysuria, abdo pain, etc. And then I want to, then they start talking about their mental health. So feeling low, etc. And then I want to enter a MSE. So I have a mental status exam, normal. The annoying thing about using templates in Oscar, I find, was when you're putting it, you're always kind of constantly navigating away from where you're working. So you're always clicking in the template area. And then also when you're putting it in, it automatically puts it in at the bottom. And I find that pretty annoying because then you're copying and pasting it and you're always moving things around. So what I started using is a software called aText. And so this is a third-party software, and I'll give you some solutions that are also otherwise available. And what these do is, if you look at aText here, main window, I have what I call dot phrases opened up. So dot one, dot two, and then you can basically set these to whatever you want. So I have dot phys, dot OCP, dot pap. And what this basically allows is when you're typing, so let's just do a prescription refill. So dot RX, you'll see it automatically opens with my template there. So medication, so let's say sertraline, 15 milligrams, indication depression. And then I also want to put an exam here, .msc, and you can see how it's automatically populating in the right area. And so my node is becoming comprehensive, but I'm also not constantly copying, pasting, or moving away from templates to chart. Now, one thing that I really want to highlight here is Marie Kondo. So think of digital clutter. Digital clutter can also exist in templates as well. So like any form of directory or organizational chart, you really want to keep it updated and succinct and really limit your templates to ones that you're going to be using frequently. So I have templates or dot phrases for things like telehealth. So dot two, I just use for telehealth, and it just automatically populates with everything. I have ones for OCP. So for example, OCP, I can just click .ocp and a bunch of things populate. So this basically just allows templates to be used more efficiently rather than spending all your time kind of copying and pasting things and you're not getting distracted from your workflow. So really minimizing those clicks. Some software that you can consider is aText, Text Expander, Phrase Express. And there's many others as well. aText and Text Expander, I believe. aText, I know it's a one-time payment. So I think it was like 15 or 20 bucks one time. Text Expander may be a monthly subscription. Phrase Express I've not used, but the one I use is aText. But I find it really helpful because then I don't necessarily have to navigate back and forth between the template screen, and I don't have to copy and paste things, and I can just do my work really efficiently. Quick actions. So this is a Cortico feature, so it has the Cortico label, but we'll talk a bit about it. So this was recently rolled out. So quick actions, what you can see here, I have quick actions for eForms built in here. And so the old way of doing it was one click and then two clicks. And then I would then have to open everything up and then submit it. Whereas with quick actions, everything's just here. So if I click LabRec, my LabRec shows up. And I'm not spending all those extra clicks and opening unnecessary windows. So really kind of minimizing that time that I'm spending doing some of these things, which is always really good. So let's just submit this. Quick actions can also be saved replies as well. So let's say, for example, I wanted someone to schedule a follow-up. The Cortico Messenger opens up and I can just send them a message. So Harini is going to get a message. She works at Cortico that she needs to schedule a follow-up. And so all of this makes it really easy to do through the quick action tab because it's more of a one-click procedure. I have the other one that I have saved here is imaging. So my two most frequent ones are saved here. So I have imaging saved here as well as a quick action. Now, something to highlight is this isn't necessarily just a Cortico feature. You can also do this via a GreaseMonkey script, but you do require some technical know-how for doing this. If you are a Cortico customer, then you could also just reach out to the support team and we can help set up the Cortico quick action feature for eForms. But otherwise, GreaseMonkey, here's some link to about some scripts as well. I got these from the Oscar Facebook group, so thank you to whoever shared that. Renew long-term meds. So this is pretty handy. So did you know that if you just click medications here, no prescriptions will renew. So even though these are marked as long-term medications, and I know these are long-term medications, nothing is renewing. However, if I click this plus, it auto-populates with the long-term medications. So that saves potentially lots of clicks depending on how you're renewing your long-term medications and if they're marked appropriately. So you can always mark your long-term medications through the prescribing screen here. And then you can also change them here as well. So let's say if I have pantoprazole and I need to change that to a long-term medication, I can change that. I can either re-prescribe it here or clicking this plus here in the corner will auto-populate all of them. So that's a quick tip to save yourself from clicking through 5 or 6 different prescriptions and quickly renew all of them all at once. Just going to pause. Is there any questions I need to answer or anything to go over?
Uh, there's quite a few, but
Okay.
I'm trying to think of the best way to sort of insert those questions without disrupting your flow. Perhaps at the end we will consolidate the Q&A and just kind of focus on the Q&A section. But
Okay.
also just want to say, like, any questions that we don't answer during the webinar, we're capturing all the questions, so we'll send out the responses to all the registered emails. There are some that I would like to do some investigation for. So, for example, some questions relating to if preferences are available in a Juno EMR interface. So we want to be able to double check that before we submit a response. So, but
Sure.
Andy, for the time being, please do continue. Maybe slow down just a tad bit.
Okay.
There's a lot of information that's being conveyed and is really useful information. And just another housekeeping issue, this recording will be sent to everyone in a registered emails address. It will also be uploaded to YouTube with a timestamp. So when we circulate the email, we'll have a timestamp of where Andy is talking about certain features, and so that'll be easier for you guys to follow. So thank you for that. Dr. Minhas, back to you.
For sure. Thank you. So yeah, so hopefully that was straightforward. Just clicking the plus here for renewing long-term medications. If it's not a long-term, just click the medication here, and then you can start typing your own. And it's always good to keep your long-term medications up to date. Pro tip, I would also say notify pharmacies if you're discontinuing a long-term medication. Oftentimes we just discontinue it in our EMR, and that causes an issue later on down the line when we inevitably get the fax from a pharmacy asking us if we'd like to renew a long-term medication, and they have basically a medrec which is different to ours. So I always notify pharmacies as well and send them a quick fax just to let them know that something's being stopped. And this will hopefully help keep refill requests current as well. Prescription shortcuts, also known as favorites. So this was an interesting feature, and I found it kind of hidden in Oscar, and it may not be hidden in all variations of Oscar, but in Juno it definitely kind of is. So let's say if we go down to the prescribing screen, what you'll notice here is let's say if I'm prescribing something like amoxicillin, this little F here is kind of hidden. And what this F does is add something to your favorites. And I'm not going to add this one, but you can type out something custom. So for example, CAP, so community acquired pneumonia, 7-day. You could also just name it amoxicillin. And then what will happen once you save it to your favorites is it'll show up on the left here. Now this is pretty helpful because you can also name it by a condition. So I don't know why, sometimes I always just forget what the otitis externa medication is or the drops instructions. So I have here otitis externa, I just click it and the drops that are covered by BC Fair Pharmacare shows up. And this is also really useful as well, especially if you're using any medication that has any complex instructions. So for example, colchicine can have complex instructions as per up to date, or you can make it more simple as well. It's really good for more compounded ones. So one I recently made was H. pylori, I believe. Yeah, so H. pylori quadruple therapy. So because you're always looking this up and it's annoying. And so it's good to just have it saved as a favorite. So I have H. pylori treatment, clarithromycin-based concomitant, and then I have the 7 or 14-day course and all of the medications listed out here as well. And so there's different, in different Oscars, it may look slightly different, but the important thing is just to maintain a bit of a list for your favorites. And so those favorites can make a lot of these things one click. Really useful one I use all the time is UTI female, because I just click it and macrobid shows up. And so I'm not always spending time just typing out medications. Most of my medications I would say are favorited. And that just makes it a little easier. So anything that's compounded, anything with complex instructions, any thing with kind of like multi-dose steps or anything like that, or even if it's by condition, it's a good idea to consider having it as a favorite. So
Can I ask, Dr. Minhas, does your favorites list get really long, and do you always feel like you have to constantly update your favorite list? Like, is there a way to like group certain things together?
right now, there isn't a way to group. Well, you technically you could group it if based on your naming parameters because it is alphabetic. So
Hmm.
that's one way you could consider doing it. But right now, I would say mine. I've been using Oscar for about 7 years now, and I'd say like this is kind of the max of it. I wouldn't say. It could be better, I would say. Certainly there's ones that I could clean up, so maybe I should listen to my own advice. But yeah, I would say I find it mostly pretty helpful. There's certainly some that I could get rid of, but some I use all the time. Like I have nasal spray, I just click it and everything kind of just shows up. And I also have May substitute for budesonide written here because sometimes I get a fax back from the pharmacy saying this isn't covered for the patient's care plan. Can you do this one instead? And so I have it kind of just written out in my favorites, so I'm not getting those back and forth communications, which are usually just added administrative burden. Um, but yeah, let me just close my preferences here. So that's prescription shortcuts. So just a tip, you can name favorites according to your conditions that you want to treat. And I like to use certain resources to help name my favorites. So I use First Line, which used to be known as Spectrum, to get regional kind of coverage data or even treatment data for recommended antibiotics. You can use UpToDate, bugs and drugs, etc. So that just makes it a little easier to manage too. Request a book. So this is a feature in Cortico, and it's currently being rolled out, and we're heavily revamping it as well. So just keep an eye out for it if you are a Cortico customer. But how request a book works is, let's say if I get a document and or a lab result, and I need to schedule a follow-up. Traditionally, what would happen is I would be creating a tickler. I would be assigning it to the MOA. The MOA would then be responding to the tickler, playing phone tag with the patient, then booking the patient in, and then notifying you via the tickler that the patient's booked in. Whereas with the request to book feature, you can just click the invite. Oh, whoops, I'm not logged in here. So I'm just going to log in. And what will end up happening is the test patient comes up. I can say it's a family doctor follow-up and it's with me. There's some advanced settings which we're working on. So for example, if you only want to see them via phone, if you want to chat with them about discussing results, and then you can just add a booking. And so what that will do is that will send the patient an email and a notification that they're being recalled, and it'll automatically handle all of that stuff in the back end, reducing administrative burden and reducing time for your MOA. So what's the end outcome of this so far? We've been experimenting with it. I have this screen open. I just took the patient name out to which is seen on the left, but you could see I did some in-clinic recalls, phone calls. This is 10 patients, so 6 of them managed to book using this method. So saving 60% of the calls to the MOA, and so saving lots of time. And so the MOA just had to phone these 4 patients, one of which turns out didn't have an email in their chart. So we fixed that. And so next time that'll be better. And you can see here, I was telling them what to follow up on. So we're trying to really improve upon the recall process. So you're not spending a lot of time playing phone tag, and just making it easier to keep track of everything and really reducing all of the administrative burden on MOAs as well. So that's the request to book feature. Sorry, window management. eForm organization. So this is pretty interesting. This is something that does take some time. It's probably kind of annoying, I would say. It took me about a month to do because I would do it in hour chunks. But eForm organization, think back to Marie Kondo and really clearing out your eForms. We have a pretty large clinic, and one of the things that I always have to maintain as well is the eForm. So making sure everyone can find everything effectively. They're not constantly asking the MOA, where's this form, where's that form, and the doctor can carry out their workflow more effectively. So organization of your eForm. So just think of digital clutter as well here. So I'll just show you our eForms as an example. So one of the things that we did was if you put a asterisk here in front of the eForm, it automatically moves it to the top. So that's always really useful, especially if you have top used eForms. So things like labs, notes, or imaging, it's good to rename them to put an asterisk in the front, just so that they're always at the top. So you're not always just scrolling down to L to get to your lab rec. Because you kind of want that to be readily accessible, especially if you're not using quick actions. The other thing is you want to have it organized according to a certain category. So for example, for us, we have our BCCH, so BC Children's eForms all grouped together. FHA, so Fraser Health Authority eForms are grouped together. And we try to keep the naming patterns consistent as well. And this just saves a lot of time because we're not spending a lot of time just searching through a library of hundreds of forms with inconsistent naming parameters. So right now, for example, I could just click Command F, do pulmonary function, and I know there's my BC Children's pulmonary function, there's my Fraser Health pulmonary function, there's my Providence Health pulmonary function. And so it just makes everything very easy to find and just really reduces that principle of digital clutter. So eForm organization. If you don't know how to rename these, I'll just go over that as well. So when you go to administration and then you go to eForms, and then you want to go to manage eForms. And so here, what you can do is you can click on edit on any of the eForms. And you can just change the name here. So VCH, EMG, neurology referral. And similarly, if you wanted to move it to the top of the list, you just put an asterisk up there and it'll move it to the top. So you're not spending all that time scrolling through the list. And then you just save it at the bottom there. So that'll help organize your eForms and really reduce that digital clutter and hopefully make it more feasible to use the eForms and reduce a lot of the back and forth that happens between doctors and MOAs when they're trying to either add an eForm, find an eForm, or trying to basically get it sent out as well. So, which we'll talk about later too.
I'm assuming that functionality is on a per user basis, right? Is it
Yeah.
functionality for like a cross organization?
Yeah, once you set it in your EMR, that's how it is for the entire EMR.
Mhm.
And so kind of falls on the certain whoever's taking responsibility of the EMR duties. But
Okay.
I was that person in my clinic. But it does take some time, but it's definitely worth it. And ideally, like in a best case scenario, this is something which should be centralized and should be consistent, but it's not. So it falls on the end user to do it, which is kind of frustrating, I would say. So keep it consistent is my tip for you. So don't do this. So don't do VGH, so Vancouver General, IM Clinic, Internal Medicine, Mount St. Joseph's, Rapid Access, St. Paul's. Instead, you want to keep it consistent so it's always easy to find. So VGH, Internal Medicine, MSJ, Internal Medicine, St. Paul's Hospital, Internal Medicine, Rapid Access. Such categories or naming patterns make it much more consistent and easier for you and new doctors to find what they need. So keep in mind that there's always going to be new doctors joining your clinic as well. And so you want to keep it very effective, efficient, and comprehensive as well. So keep it consistent, just stick on a naming pattern. You can either keep to categories, but just I know when we're quickly trying to add things, or if we delegate it to a third party, sometimes it's just a random thing will be added. And so it did take some time because I was constantly going through eForms and renaming them. But it did pay off in the end, I think, and it does make the work a lot more feasible and enjoyable, I would say. Automate billing. So this is, I believe, the last critical feature that we'll go over. So automate billing. So what do I mean by that? So traditionally, this is how we do billing. So we just click the $ here to sign save and bill. Here, saving note. Whoops, I'm not sure what's happening here. Maybe I need to do it from here. And so what would happen is I would click, for example, a telehealth visit. I would then have to enter 250, let's say it's for diabetes. And then I would click continue. And then I would click save bill. Now, as you have seen, that's a lot of clicks. And one of the things that I'm really trying to do is minimize the amount of clicking that I'm doing. So before I get audited, I'm just going to delete this bill. So this was a Cortico feature which we developed called billing automation. So what you can see here is we just turn it on and save it. Oh, by the way, you can see my reasons for visit here. So let's say I'm seeing this patient. I can just click on saving a service. And so what it'll do, it'll remember the service that I'm carrying forward. So especially if you work in blocks, this is really useful. So for example, for myself, I work in telehealth in the morning and I'll do in clinic in the afternoon. And so when I'm doing my billing, I can basically just click virtual consultation. And then I can just click 250. And then the save bill has been moved here. So it gets rid of that extra window that you're no longer clicking through, which really adds up, especially if you're doing it 30, 40 times a day. So I'm just going to click save bill. And so next patient is a rash on their neck. So let's say if I'm going to bill this one, you'll see that this is automatically checked off. So I'm not having to check anything. I just have to enter a code. So rash is 7821 and save bill. And so what used to be a multi-step process is now an easy process. So for example, if this is depression, I can just click that. It was cold, so that should be 460, sorry. Doctor's note, so let's say if there's nothing abnormal, 11A, and I can just save bill. So that makes billing very easy to do, and suddenly it removes it from being a 4 or 5 click process to basically a 1 click or 2 click process. So that's automate billing. And I'm just going to delete that. And that works for, so we made it work for encounter codes. So anything relating to visits, telehealth or in person, it just basically remembers it. And it'll also adjust for age as well. So if there are any age adjustments, so let's say if it's you see a baby, but next time you're seeing someone who's 80, it'll auto adjust accordingly as well. So really help automating some of that processes. I should mention as well, it can also save the time. So let's say if you are always entering the same time for your billing, you can just have it remember the time as well to carry forward if you're working in blocks. So pro tip, you can turn it on in Cortico's plugin settings. Other settings include pathway integrations, virtual hallway, and more. So you can find those here. So that's kind of organizational settings, pathways, API keys, virtual hallway, etc. And then there's provider messaging. So a lot of these settings you can turn on. Update directory. So this is interesting because it's not really advertised, but what you can do, I'm sure the Oscar service providers are going to hate this, but what you can do is you can just email them to ask them to update your directories. So especially the consultant listing or the pharmacy listing, instead of adding them one by one, what you can do, I work with Juno, or well, I don't work with Juno, but I use Juno. And so I just send them an email saying, can you update my pharmacies? And then they will update all of them and have all of them added according to your region. And same thing for specialists as well. So it helps keep your specialists up to date. It also helps keeps your pharmacy up to date. So I try to do this at least on an annual basis. So I have a reminder set around January 1st to email my Oscar service provider to update the pharmacy and consultant list. And that way you're not having to constantly add new providers, constantly having to add new pharmacies. You may have to here and there, but it's not necessarily one big add. I like to just bulk it with my Oscar service provider. Save on faxing. So everyone likes to save money. So this is a good tip. So if you're on Juno or Oscar Pro with, well, I'm not sure with other OSPs whether they support this yet, but we switched to Ring Central. So other fax providers were charging quite a bit. And Ring Central's eFaxing integration is available now. And so it's unlimited eFaxing for around $45 a month, which is always great because sometimes it can go into the hundreds of dollars a month depending on the volume of faxes you're getting. And I believe there's a beta in trial, so you can contact Adrian, whose contact information I'll give in the next slides. But you know it's currently available as well. I would say there's some discussion back and forth of whether or not you need a business associate agreement, and that's basically just sending them an email saying that we need confirmation that you're going to be PIPEDA compliant, which they send you. But RingCentral is a massive company, and I haven't had any issues with it. You could also use them for your voice over IP phone solution, but I believe RingCentral or TELUS is white labeled RingCentral, so we could have that set up as well and save some money. But that's a quick way to save some money on faxes too. eFax eForm. So this is super useful. I find. Let me just show you here. So right now, what we implemented is within our top used eForms, we implemented secure faxing solutions with central intake numbers. So what you can see here is, let's say I want to do an ultrasound abdomen, and it's like right lower quadrant pain, and I want it urgent. Before, what we used to do is we might have to print this out. The MOA might have to find the fax number of the central intake line or the hospital. But what we did is we had a custom eForm made. And so it has all of our local imaging facilities here. So let's say if the patient is near St. Paul's Hospital, I just click St. Paul's. It auto-populates with all their information. It also auto-populates with their fax number as well. And so I can just click add fax and submit and fax it. And that way I'm not printing it out. I'm not creating unnecessary ticklers, but I'm basically just automating that whole process for ordering certain investigations and quickly used investigations. So I have West Coast Medical Imaging is a local imaging facility. So my advice would be, where possible, use central intake numbers. So now it populates with West Coast Medical Imaging central intake number, and I can send it there. And so I have the same thing set up for my labs as well. So let's say if it's a lab requisition, right now, what you'll see is there's a bit of a time delay, but it'll populate with LifeLab's central intake line. And so your central intake line may be different locally, but it's important to just modify your eForms so that you can quickly submit and fax them if you're not sending them through the messenger, which will send it as an attachment. But if you're not necessarily doing that and you just want to fax it, you can just submit and fax it there and use the central intake line. This does require some eForm setup, but it's definitely worth it because it'll save paper, it'll save time, and it'll save on admin expenditure. And it's really promoting that concept of efficiency and 1% gains that we're really aiming for. So yeah, eFax to common eForms such as labs and imaging. Where possible, add central intake numbers. Keep in mind, you can add a drop-down list. So like I showed you for imaging, it doesn't necessarily have to be one eForm per imaging facility. You can have a multi-site imaging facility or multi-site eFax form set up. So you can contact your Oscar service provider. They might charge for it. I got help from Adrian, so that's his email. He's an independent consultant for Oscar EMRs. So any sort of eForm customization, great work and reasonable prices. And other useful groups. So if you're not part of these groups, we'd encourage you to join. So there's the Facebook groups for Oscar EMR, Oscar Ontario, and Oscar BC Community. Adrian's been a great help and contact for doing things like eForm creation, development, training, database reports, and etc. We also have a free version of the plugin as well, which you're more than welcome to download as well. But yeah, I believe that's it from my end. And happy to take any questions. Hope that was helpful.
Wow, thank you. That was a very intense 45 minutes. Uh, uh, I think there was quite a few answered questions, but also a lot of open questions. I don't believe we're going to be able to answer all the questions. I do want to respect everyone's time and keep this webinar to an hour. So we'll end at 6 o'clock on the dot. But any questions that we don't answer, we'll circle back with you individually and try to come up with a response. This might also potentially kick off us developing other webinars focused on perhaps one of the 12 topics that Dr. Min has touched upon today. So with that, Dr. Minhas, I'm just gonna go through the Q&A from the earliest to bottom for those that we haven't answered just yet. So the first question is to how to add a patient's photo to eChart in the old version of Juno.
Ooh, honestly, no idea. I've never done that. I'm not sure if there's any, Ian, I saw you were on as well. I'm not sure if you would know, but I've never added a photo to a patient's chart. So I'm sorry, I wouldn't have the answer to that.
We do through the Cortico on the booking system, like we have the patient intake form where we can facilitate uh, patient's photo being added to the chart. But I'm not sure if that really answers your question. We'll circle back with again you directly for follow-ups there. The second question here from Anita Ing, is there a way to bulk delete templates? There are many that came with our system and we have made our own.
I just want to confirm, is that referring to like eForms or oh, actually, no, sorry, templates. Not really. I think you just have to go to a new edit template and then you have to kind of go through it one by one. Same with Oscar eForms. Yeah, it is annoying, trust me. But you kind of just have to spend the time to do it. There's not really an easy way that I found to kind of bulk delete some of these things. So let's say if I click that and I would delete it. So I could actually do with cleaning my own up. But honestly, I haven't really been using templates that much because I just use Atext now. So
And speaking of ATEX, does it work on Juno?
yes, yeah. So here's Juno, so .mse, and you can see everything's being populated, .rx, everything's being populated, and it populates where you want it to as well. So it's really nice.
I'm just going through the Q&A. I thought there were a couple of ATEX questions. Might have missed them. If it's fine, we'll move on. From Abdul, what is the software you used avoiding copy and paste? Like OCP comes in a systematic way. How can I use this with Oscar? Like I need to download at work, at desktop and my laptop.
I believe this is the Atex, so I use Atex as the software I use. It's available on Windows and Mac. I think it's like 10 or 15 bucks for the paid version. And that's not monthly, that's a one-time fee. And you can also save your templates across different devices or in the cloud, so it's pretty handy. And then I also see a question here about from Dr. Pham, I believe, about setting them up. So all you would basically have to do is when you're using the Atex software, you just basically, it's called create a macro. So new snippet. And so for example, I'll show you here. So let's say dot Cortico, and I say Oscar is the best. And so if I start typing here, dot Cortico, and you can see it switched to Oscar is the best. And so it's super easy to set up. It's just a piece of software that you download and then you enter your templates, but always beware, keep your templates concise, keep them to the ones that you use frequently. I have .1 as my as my in-person, .2 as my phone, .3 as my video. So less clicks, less types, always the best.
There's another related question to ATEX, which is installing and connecting a third-party program. I don't think we'll answer that. Perhaps it might make sense for us to circulate the link to ATEX after this webinar, and then any instructions can be provided by the third-party program directly. All right. Quite a few questions have since flowed in, so I'll keep us moving along. From Omar, is there a way that you prescribe meds based on BW, body weight, I believe, like you just prescribed? The system picks the weight and automatically calculates how many mils to order.
Not as far as I'm aware. What I have set up right now is I do have, for example, I have amoxicillin suspension set up. And so sometimes I just write like, for example, 50 milligram per kilogram divided TID, POTID, and then I'll just put the weight like 15 kg, right? And then the pharmacy usually does the math. So that's one way to do it. But yeah, I don't think there's a way of automatically doing that based off of weight.
And just on the medications, is there a setting for long-term medications automatically happening with the plus sign? It doesn't happen in my Indivicare Oscar.
I would email your OSP. There's no setting that I've come across.
Mhm.
It's always worked in the Oscar that I have. So yeah, that's kind of frustrating. But maybe they've disabled it or they need to add that feature back in. But it's super handy, as you can see, and it saves a lot of time. But I believe that was kind of the original kind of design of it, and it's worked that way for me at least for the last 7 years, despite like the various Juno updates.
Thanks, Andy. There's a couple questions on the favorites. I'll kind of group them together a little bit. So we spoke briefly that the eForms, when those are set up, those are based on a per clinic basis. Is it the same for RX?
For
It's like,
eForms?
are those favorites like RX for
Oh,
all
for favorites?
patients?
Oh,
Yeah.
so what you can actually do is you can copy other people's favorites. So you can click copy here, and then you can choose a provider. So right now, no one's set up, but when you are setting up a favorite here, so let me just show you. So let's say if I'm setting up pantoprazole as a favorite, actually, let me see where, maybe it's in here. So edit. Uh, I believe there is a setting here somewhere where you can copy the group's favorites. Save, changes, delete. I'll have to look into that, Alfred, but there is copy here, and I know that the copy does let you copy other providers' favorites, so you can create more organizational ones there. But it is meant to be kind of more individually based because every doctor kind of uses something different in a sense. Like some might use Bricanol inhaler, others might use Ventolin. And so, yeah, it's kind of, and you might have different naming conventions. So it's, yes, you can, there is a way to copy them for an org, but ideally probably want to do your own.
Thanks. Right, just moving on here. How can one upload referral forms to the eForms without sending it to Oscar officials?
Oh, so I guess this is more so about creating a custom eForm. So custom eForms, it's a bit convoluted, and it may look different based off of which version of Oscar you have. But typically what you need to do is number one, create a PNG of that image. So let's say if you have a PDF, you want to export it as a PNG file. And then what you would do is in the eForms, you would click on upload an image and you would upload that PNG. And then once it's uploaded, you can go to create an eForm and use eForm generator. And so eForm generator lets you, for example, let me just move this over. I can add a page. So let's say I'm just going to add a random page here. So just too zoomed in. So let's say sleep apnea. And then this is the sleep apnea one. And then what you can do is start building your own form here. So you can add text box, templates, etc., drag and drop them. You can pre-populate them with database tags. So let's say if you want, like, for example, the current username, you can put that here. And that way you can start just creating your own eForms, and it's super easy to do. And I believe there's like some YouTube videos out as well for eForm generator use, but the key is upload the PNG, use the eForm generator, and then use pre-filled database tags or placeholder text Yeah, it makes it really easy to upload your own eForms then. What you may need help with actually though is adding fax numbers and fax features to eForms because that actually requires some HTML coding. So you usually have to reach out to an OSP or Oscar service provider or someone like Adrian to help set that up.
Thanks, Andy. Another question. I think you covered Natalia's next question, which is how to load new fillable eForm, for example, the lung cancer screening requisition. I believe your live demo basically shared an example of how one could set up eForms. Let's move that. We've only got a couple minutes left, so maybe we'll do one more Q&A, but before we'll do closing. Um, from Wilson Wong, if you ask OSP to update directory, does your previous manual updates get overridden?
Um, Let me just remember. I don't think it did. Let me just see here because I know there's some old ones that we have. So no, we're good. Yeah, mine are still here. So they might add some categories here. So like for example, what we had was like two separate cardiologies, and I had to clean that up a bit. But it does keep it more up to date. So
Perfect. Thank you, Dr. Minhas. Yeah, let's sort of get into closing, recognizing that it's almost 9 p.m. For folks on the Eastern time zone. Yeah, no, again, thank you, Andy. This was really intense. 58 minutes of really learning how to improve using Oscar. There's a lot of questions that we haven't been able to answer, and a couple others that we will follow up directly with. But on behalf of the team here, just want to thank everyone. Thank Andy. We hope you enjoyed today's presentation. If you have any feedback on any of the topics that was discussed today, please feel free to let us know. We'll be sending you an email with the webinar recording probably in the next couple of days. Probably take us a couple of time, a bit of time just to add the timestamps and try to drill down on everything that Dr. Mann has covered today. Yeah, if there's anything that you want to talk about in terms of boosting your clinic's efficiency, Cortico has a practice management platform. We've been proven to be able to help with a lot of automations and workflow improvements. So if clinics you're struggling with in never-ending stream of inbound phone calls, crowded waiting rooms, or maybe your doctors and staff are spending a lot of hours on tedious repetitive tasks, then perhaps reaching out to us for a one-on-one conversation to see how we could help you with that. We'll send you some information to follow up with. There's also a QR code here if you want to take a picture and schedule a call with us. So for time being, thank you again for joining us for the 2024 Oscar Tips and Tricks webinar. We'll see you again soon. Thank you, everyone.